Hi all, I am Dr. Nikhil Shalgi, consultant surgical gastroenterologist and advanced laparoscopic surgeon working at Manipal Hospital, Whitefield. Today we are going to discuss about colorectal cancers. Colorectal cancer is a cancer involving any portion of the large intestine. Rectum is the last portion of the large intestine, so cancer involving the rectum is called rectal cancers. So the risk factors for the colorectal cancers include family history of colonic or the rectal cancers in the family. The risk increases if it's in the first degree, that either in the parents or in the siblings. The other risk factors includes inflammatory bowel diseases, either it can be Crohn's disease or ulcerative colitis, obesity and consumption of too much of processed meat or red meat, low vitamin D levels and smoking. These are all the other risk factors which have been associated with high risk of colorectal cancers. The symptoms can be varied starting from new onset altered bowel habits. It can be either constipation or loose stools and presence of excessive mucus in stool, and having blood in stool, or patient presenting with anemia because of blood loss in the stools. Other symptoms can be either pain while passing stools, that is we call it as tenesmus, and patients can present with blockage in the intestine because of the tumor, so they can manifest as acute lower abdominal pain or abdominal distension. So once the patients who have been having these symptoms or risk factors, we would make diagnosis with the help of blood tests and colonoscopy and cross-sectional imaging. So the basic blood test includes complete hemogram with liver function test, thyroid function test and a renal function test. So then we would get a colonoscopy done. Colonoscopy is a detailed endoscopic evaluation of the whole of the colon, rectum, starting from the anal canal. So during this procedure, we would go through complete examination of all the parts of the colon, and if there is any polyp or a tumor, we would take a biopsy from that lesion. So once the diagnosis, histopathological diagnosis is made as a cancer, then we would stage the disease. The staging is done by either by a CT scan or a MRI scan or a PET scan based on the presentation, based on the location of the tumor. So this will tell us what is the stage of the disease. So the surgical treatment is the main modality of the colorectal cancer. So, but again, since it is being a multimodal approach, we would plan the treatment based on the presentation and tumor staging. So most of the patients with colonic cancers would undergo surgery followed by chemotherapy based on the stage of the disease. Patients with rectal cancers usually would get a MRI done before we come to know the stage of the disease. Based on that, we would give neoadjuvant chemoradiation and then surgery. So we at Manipal Hospital perform most of the colorectal cancer surgical procedures using minimal invasive approach, both laparoscopic and robotic, and the success rate has been comparable with most of the high volume centers. Thank you.